And as I've mentioned, we have done a fair number of studies looking at different types of spiritual practices. These are a set of scans from one of our early studies where we looked at a group of Franciscan nuns who was doing a kind of prayer called centering prayer, which is kind of a meditative type of prayer. You actually focus on a particular phrase from the Bible or a particular prayer. It's not quite like a mantra-based practice where you just keep repeating it over and over again, but you reflect. It's actually more of a mindfulness-based practice where you keep reflecting on it. What does it mean to you? How do you think about it? What do the words mean? And you keep looking and focusing on it to the point where you become absorbed into the prayer, you become absorbed into the practice, and it's a deeply spiritual experience for the person doing it. So what are the areas of the brain that turned on or turned off during this practice? Well, this is a kind of scan called a SPECT scan. Many of you are probably familiar with the fMRI studies, the functional magnetic resonance imaging studies, which are also wonderful studies to do. They look at blood flow changes in the brain, and so does this scan. This scan involves administering, we inject through an IV a very small amount of a radioactive tracer that gets up into the brain and follows the blood flow as it gets up into the brain. One of the great things we have come to learn about how the brain works in general is that the more it uses a particular part of the brain, the more blood flow it gets. It's like, stepping on the gas pedal of your car. So when you do that, you get more blood flow there, and that allows that particular part of the brain to work more. And it tells you what areas of the brain are active or inactive during a particular state. In fact, it's these kinds of scans, which is also part of what has taught us about what Dr. Brainerd was mentioning, the default network, and how our brain works when we're at rest, which is what you're seeing over here. And you can see that when you're at rest, your brain's still doing a lot of stuff. It's still on. But when you're now actively doing something like prayer or meditation, your brain does something a little bit different. The way to interpret it, this is the front part of the brain. This is actually as if you took a slice through the head and are now looking down on it. So you've got the front of the brain here, the back of the head here, and the colors represent the level of activity. So the reddish areas are the most active, the yellow areas are slightly less active, followed by the blue, and then ultimately the black, where there's very little, if any, activity. So during prayer, we see an activation. There's a big blob of this red activity here that you don't see over here. And as I mentioned a few moments ago, that's what the frontal lobe does. It turns on when we concentrate on something, when we focus our attention on something. And this is what this part of the brain is doing for this particular individual, for this nun, concentrating on the particular prayer. She also activates the language areas, that verbal conceptual areas along the side of the brain, because it is a verbal type of practice. They're reflecting on a prayer. They're repeating the prayer. They're saying the prayer. They're understanding the words. They're reflecting on what it means to them. And we don't see this when we have studied, for example, Tibetan Buddhist meditators doing a visualization technique. There we see the visual areas of the brain lighting up, not the verbal areas of the brain lighting up. So we're able to start to differentiate different perspectives of spirituality, different views of a spiritual idea or concept, and we can begin to apply these to all different aspects of religious and spiritual beliefs, including the concept of God. Now, we decided to get a little crazy at one point, and we said, well, maybe we should see what an atheist does when they contemplate something spiritual. And I had a good friend who had practiced meditation for 30 years or more. He was a very devout in terms of doing his practice on a daily basis, so he was a very good meditator, but considered himself to be an atheist. So I said, well, why don't you come in, let's scan you, and for your object of meditation today, why don't you focus on God? And let's see what happens. So when we look at his scan, it's actually very interesting. Now, you have to take this with a grain of salt because it's an N of 1. Although actually we did scan 2 people who did this and we saw similar things. But, this is not a big randomized trial with hundreds of people in it. But taking it for what it is, it was very interesting because here is their resting state again, and everything kind of looked relatively comparable to everybody else's brain who we had scanned. And you can look at when you're just sitting there awake, your frontal lobes are just on a little bit. They're ready for whatever's going to happen in your environment. And when he started to meditate, what was interesting was he didn't really turn on his frontal lobes very much. In fact, maybe one area went up a little bit, the other area maybe went down a little bit. It just kind of didn't do much of anything. And I thought that this was very interesting. It may actually reflect the importance of the belief that you hold about your practice as being a very central aspect of how well you can do the practice and how well your brain can maybe wrap itself around the concept, so to speak. Because in this particular case, he was not able to really meditate perhaps as deeply as he would like to on a concept or a topic that he didn't really believe in. So his frontal lobes were just kind of spinning their wheels. They didn't really go anywhere, whereas the nun or somebody who has a very deeply held religious belief, their brain goes crazy thinking about religion and God. So what I think we're able to show here is a little bit about how different brains respond to the concept of religious and spiritual beliefs, so that some people can really embrace them fully and other people have trouble doing it. Now, the larger question, of course, and this is something that we're going to talk about a little bit later, is why is this? Is this something that is kind of genetically hardwired into each of us, and that perhaps all of you here who are very involved in yoga and meditation and different practices, were you born that way? Is your brain set up in such a way that from the moment that you were born, meditation and yoga and all these different practices just felt right to you? Or is it something that because you got into doing it when you were in college or when you were a kid or something like that, and as you did it more and more, it became ingrained within you as your brain did this? And I think ultimately the answer is going to be a little bit of both. And we'll talk about that in a few moments. But I think this, again, is starting to tell us a little bit about how we can use science to explore questions about our religious and spiritual beliefs and how they have an impact on us.